This is follow-up video from yesterday where natural remedies were discussed. This video will discuss different exercises at home proven to help with sciatica pain. Please subscribe, share, like and comment please to help people suffering from sciatica. That sharp, shooting pain that travels down the back of your leg, better known as sciatica, is not subtle sciatica, an affliction that affects up to 40% of people at some point in their lives, can often be addressed at home with some simple, tried-and-true techniques. Symptoms can vary from annoying and nagging to total inability to ambulate, walk. Here's a closer look at what might be causing the pain, and some ways to manage it on your own. Causes of sciatica. The most common cause of sciatic pain is a herniated disc. According to Dr. Mirza, this happens when the jelly-like center of an intervertebral disc pushes through the outer ring of the disc, or causes this ring to bulge, putting pressure onto the sciatic nerve, technically called the L5/S1 nerve because of where it's located on the spine. In addition to a herniated disc, other issues can also trigger sciatica, says Dr. Mirza. These include arthritis, bone spurs, aka bone overgrowth, cysts or tumors, disc tears and degeneration, nerve damage due to diabetes, torn or thickened ligaments, ligamentum hypertrophy. The way we move and carry ourselves can also exacerbate the root causes of sciatica. Twisting, bending, or even coughing or sneezing can worsen sciatica pain. Who's most at risk for sciatica? While almost anyone can develop sciatica at some point in their lifetime, there are a few factors that increase your risk for experiencing this pain. Among the older group, in contrast, sciatica tends to be caused by the buildup of bone spurs, thicker ligaments, and arthritis onto the nerve, stuff that develops over decades of gravity, force and stress. A study in the British Medical Journal highlighted other potential risk factors, including smoking, obesity, and mental stress, as well as occupational factors such as jobs with strenuous physical activity, lifting, especially while bending and twisting, and extended sitting and driving. Symptoms of sciatica. Symptoms of sciatica include 1. Pain from your lower back or butt and extending down one leg. The pain may be dull, aching, shooting, or burning, and it can sometimes feel like an electric shock. 2. Feelings of muscle weakness or altered reflexes. 3. Numbness or pins and needles, tingling sensation. Depending on the location of the compressed nerve, symptoms may get worsened when coughing or sneezing, bending over, lifting objects, twisting, sitting down, or sitting for a long time. It usually only affects one side of the body. In most people suffering from sciatica, the symptoms completely resolve or dramatically diminish in 2 to 6 weeks. How to find relief at home. Exercises for sciatica. Seeing an experienced person doing a handstand or contorting their body like a pretzel can make yoga seem intimidating. But there are several gentle exercises that people of all fitness levels can do, and some may provide sciatica pain relief. Standing hamstring stretch. This can ease pain and tightness in the hamstrings often associated with sciatica. To do this pose. 1. Place your right foot up on a chair or step with your leg straightened and your foot flexed. You can slightly bend your knee if needed. 2. Bend forward slightly toward your extended foot. Stretch only as far as you feel comfortable. 3. Hold for 30 seconds, then repeat with the other leg. Sitting pigeon exercise. This pose can provide sciatica pain relief by stretching the glutes and lower back. To do this pose. 1. Sit on the floor with your legs stretched out in front of you. 2. Bend your right leg and place your right ankle on top of your left knee. 3. Lean forward and stretch toward your thigh. 4. Hold for 15 to 30 seconds. 5. Repeat on the other side. Reclining pigeon exercise. The reclining pigeon pose helps stretch the piriformis muscle, which can sometimes press on the sciatic nerve. It also stretches the hip rotator muscles. To do this pose. 1. Lay down on your back and bring your right leg up to make a right angle. 2. Clasp your hands together behind your thigh. 3. Lift your left leg and place your right ankle on top of the left knee. 4. Hold the position for 15 to 30 seconds. 5. Repeat on the other side. Knee to the opposite shoulder. This stretch provides sciatica pain relief by loosening your gluteal and piriformis muscles. To do this pose: 1. Lie on your back with your legs extended out and feet flexed. 2. Bend your right leg and clasp your hands around your knee. 3. Gently pull your right leg across your body toward your left shoulder. Only pull your knee as far as it will comfortably go. 4. Hold for 30 seconds, then release your leg down. 5. Repeat for 3 reps, then switch to the other side. Groin and long adductor muscle stretch. This gentle stretch releases tension in your muscles and eases pressure on the sciatic nerve. To do this pose: 1. Sit down on the floor with your legs straight and spread apart, as far apart as is comfortable for you. 2. Place your hands out on the floor in front of you. 3. Lean forward and place your elbows on the floor, if you can. 4. Hold the position for 10 to 20 seconds. When to see a doctor. Though sciatica usually goes away relatively quickly, certain symptoms and situations require more immediate medical attention. 1. Bilateral, both sides, leg symptoms of pain, numbness, or tingling. 2. Continuing inability to go to work. 3. Difficulty walking due to decreased coordination. 4. Inability to initiate urine or completely void the bladder entirely. 5. Incontinence of bladder or bowels. 6. Numbness in the groin or saddle region. 7. Pain at night that doesn't change regardless of changing positions. 8. Pain that does not decrease in intensity after a week or 2. 9. Progressive weakness in the legs. Preventing future sciatica attacks. Research shows that if you don't address some of the underlying issues such as a herniated disc or arthritis, sciatica is likely to recur. But there are things you can do to reduce your odds of feeling the pain again. Stay active. Don't stand in one place or sit for too long. Both put excessive, ongoing pressure on the spine. That means getting up from your chair frequently and gently stretching or move around, especially if you have a desk job. If you have to sit for 8 hours a day, get a standing desk, or set your phone timer to go off every 45 to 60 minutes. When that pings, get up, walk around a little bit, take a break, and change your position. Move smart. Avoid activities and movements that can cause sciatica. Once you know you are prone to the condition, avoid lifting excessive weight and steer clear of activities that involve a lot of. Mind your posture. Since sciatica stems from your spine, it makes sense that good posture can also play a big part in reducing its likelihood. When your spine is out of alignment, whether you're tilting to one side, or leaning forward or backward excessively, back problems and sciatica are more likely to occur, says Dr. Kim. A few cues to keep in mind. 1. Bend your knees and lift heavy objects from your legs and avoid bending forward. 2. Don't hunch over. 3. Keep your spine in a neutral alignment when walking or sitting, with your shoulders pulled back and chin tucked slightly. Strengthen your core and improve your flexibility. Strong legs and abdominal muscles support and take the pressure off your spine, so regularly incorporate exercises to target these muscles. Similarly, improving your flexibility with activities such as stretching, yoga, or Pilates can help keep your spinal muscles and hip muscles from becoming pinched or contracted. One British study found participants with low back pain, including those who suffered from sciatica, who did a series of exercise classes had significantly less pain after 3 months than a control group. Use supportive devices. There's no shortage of products on the market that are promoted to reduce back pain. In the case of preventing sciatica, lumbar pillows or ergonomic chairs may prove helpful. Lumbar pillows help maintain the neutral arch of the back, decreasing the stretch on the discs and the nerves. With an ergonomic chair, look for one that will allow you to position the seat at the right height for you, so that both feet are on the ground and your hips, knees, and ankles are angled about 90 degrees. Whatever chair, pillow, or bed gets you into neutral alignment is probably the best choice for you.